Hello, I'm Stephanie Zanvetter from Gaylord Hospital. I'm a physical therapist with a clinical specialty in stroke. And for this particular topic, we're going to be talking about home safety after a stroke and some home modifications that might be beneficial to you as a stroke survivor in your transition from hospital to home. And so there's a lot of things to consider when making the transition to home. And so many of you in participation in our stroke education series have received a manual. And so there's a lot of information in that manual. And so some of the slides that we'll talk about here today kind of highlight what's contained in the manual. Ultimately, we'll ask you when you first come in as far as the type of home that you live in, right? So we need to understand, do you live in a house with stairs to enter or an apartment, right? Are you in a condo? Do you own the home or are you renting, right? And that helps us with sort of knowing what modifications might you be able to make versus some that may be just logistically not able to be done. Understanding the entrances to your home, the accessibility as far as stairs and or ramp entries, right? Whether or not you already have existing and or the ability to have ramps put in. Even knowing from a stair perspective, the safety of those stairs, right? Are we talking about something that's a little rickety and old or needs some repair? Or are we something that's just concrete and sturdy and ready to go, right? So your therapy team will be asking you some questions about the setup as well as, right, who you live with as well, right, to see whether or not from an accessibility perspective, we need to offer some training to that individual. We'll also want to understand from an interior perspective, right, what are some barriers to your safety with your mobility within the home? That can include things like either clutter or throw rugs, transitions or thresholds between rooms, right? Whether or not you have pets within your home, right? And just generally speaking, what the layout of the home is. And so don't be surprised as you make that transition, the therapy team may ask your loved one if they're coming in for training to either take some videos or take some pictures so that we can look at with you and kind of help make some suggestions as you make that transition to home. Some additional recommendations, some things to kind of think about as far as lighting and accessibility to light switches or different things, whether you have a night light. We often will sort of have people, obviously, if you're moving about in your rooms in the hospital, we have the lights on, right? When you're moving in therapy, you have the lights on. Okay, well, if you don't plan to go home and leave all your LED lights on, then we need to kind of see how you move in the dark a little bit. And we can expect that that might be quite a challenge for some of you. And so perhaps having lighting in certain areas just to kind of assist you if you had to get up in the middle of the night to use a commode or something like that bedside, just to help with being able to kind of see and keep you safe. Even things as far as arranging the furniture. This is some work that ultimately might be done with the home care therapist coming in to do a home evaluation with you. They might make some suggestions as to how you can lay out your home so that things are accessible from a wheelchair perspective or a walker so that you can certainly get into your bathroom, right? Being able to use tub or a shower, some of those types of things, get around your kitchen, and just to be able to access the different levels of your home. As an example, for someone who lives in a split level home, right, where they might have to do stairs to get to a main level and or stairs down to get to another level, whether or not you can stay on the main floor of the home so that you don't have to navigate those stairs if that be a barrier for you. We talked already about lighting and stairs with respect to safety and handrails and different types of things. Many homes will certainly have the ability to have handrails put if you are the homeowner, right? So for example, it's understanding if you do have a handrail, well, which side is it on? And will that side be accessible and or available to you to work, or do we need to have another rail installed as well? With respect to fall safety in transitioning to home, many things are done to help the stroke survivor with respect to not only being able to move safely within the home, and this is hopefully some education you've received from your therapy team as far as if there are visual impairments, being able to kind of structure things in the environment and to use some strategies that you've been taught in your therapy sessions to keep you safe at home, to working with your physical therapist on utilizing some of those assistive devices that we talked about to help you with navigating within the home, understanding as well from your therapy team with respect to how your balance has been impacted, right, and what your falls risk is. Gaylord offers a fall prevention class to help individuals in making that transition with better understanding what your risk for falls is, as far as understanding what exercises, what activities might be beneficial for you to keep going with to help with minimizing your risk for falls. Certainly, many falls do occur within the home, particularly in the bathroom, and or if we're talking about unlevel ground or things like that that need to be addressed. An important component in being able to experience what we call fall recovery is one aspect that you may be participating in with your therapies as far as an activity goes. So your therapist, where and when safe to do so, may offer you either a demonstration and or have you participate in the task itself on being able to demonstrate your ability to get down to the ground and get back up in the event of a fall. They may also opt to train your family members with respect to where to stand or how to facilitate this transition. Certainly the idea being that if a fall were to occur, how to position yourself just to kind of take a break before you try to get back up again, just to make sure that there are no injuries, right? And obviously, should there be an injury or suspicion of injury, naturally that recommendation would be that you'd want to go ahead and, if you've hit your head, you call 911 or call your doctors, right? And get help right away. We talked about the ability to get up from the ground in the event of a fall. And so, these are just some of the steps involved. This is a particular slide that sometimes we'll offer those that are transitioning to home, and or, to be honest with you, I found a lot of family members like to just take a video of that transition, just so that way they can kind of see, where the therapist is standing. If you're not able to participate in the activity yourself, you can at least direct someone who might be able to offer help as to how to help your loved one in getting up from a fall. And so these are basically just some steps that we'll practice with folks, so that way, as I said, there's a strategy, right, as well as a technique maybe and how to perform that task. Your therapy team, while here at Gaylord, will speak with you about equipment that might be beneficial to you to help you with being safe at home. Commonly in occupational therapy, your occupational therapist may ask you as to whether or not you have a commode or benefit from having a commode either bedside or even over an existing toilet if the seat height is too low and difficult for you to stand from. They might also ask you, of course, about how your shower, how your bathroom is designed to best understand whether or not you'd need a tub or a shower bench, right? And what that threshold is like to make sure that you have a strategy as to how to safely navigate that, as well as whether or not any grab bars might be beneficial and where to place them from overall safety perspective. They may also offer you how to obtain this equipment and or where to go, even those shower heads that are removable essentially, so that way you can kind of take a shower versus just a sort of that stationary piece, right? Your physical therapist will offer you some education as to different types of equipment that might be safe for your mobility, as far as what type of tool for walking, whether that be a walker or a cane, as well as whether or not you might benefit from any bracing from a weaker leg. And sometimes it could be something like an air cast, right, which is often offered to individuals to help with respect to some ankle stability that might be necessary after a stroke, or an AFO, or an articulated AFO, which is basically a lower leg brace that is offered to individuals that present with foot drop, whereby, again, the individual's foot or toes do not pull up as they're walking. And so there's a clinic that your loved one may participate in, whereby you might be fitted for a brace and have an opportunity to practice in utilizing that brace while you're here with us. But these are, again, all types of equipment that you might expect to understand a little bit more about as you make the transition out of the hospital and to home. Thanks again for watching. I'm Stephanie Zanvetter, and I hope that you'll take the opportunity to check out some of our other videos here at Gaylord on stroke recovery.